So first off, I know you all have backgrounds with the 12-step recovery program, and I myself have a background in that too. So I'm really interview with y'all because that's pretty awesome. It works if you work it. So can you go ahead and first kind of tell me how you all met?
Yeah. Lisa, do you want me to talk about how we met?
Yes, please. I love your origin story.
So Lisa and I met at an AA meeting in North Berkeley or North Oakland on a Saturday night in 2009. So we were sitting next to each other, and I had just moved to the Bay Area, and Lisa had just moved 9 months before or something like that, 6 months before or something. But anyway, it was sort of, our knees were touching, I remember that, and it was sort of love at first sight. So we immediately started talking, just chatting like you do at AA meetings, and we started talking about how we both went to University of Michigan, and we both have this Ann Arbor connection. Lisa is from Ann Arbor, and we just became very close, so very fast. I think we've always had a lot of natural charisma, a lot of natural chemistry. So we became friends, and then we became colleagues. And so Lisa had very fancy jobs at different places, but she ran something called OER Commons. So she ran the open source education platform, and she gave me one of my first jobs at my design studio that I started in San Francisco. So we always, from the very kind of beginning, had this hybrid relationship between friendship, supporting one another in recovery, and colleagues, and that's how we met. So we met, and so we talked for a long time about doing something in the field of addiction before we did, and then, I think it was just one of those things that we were in the Bay Area. There were a lot of really interesting digital health kind of innovations at that time. It was a really exciting time back in 2012, 13, 14. And we felt as though, and maybe this resonates with you, but we felt as though everybody was ignoring addiction. So nobody wanted to touch it. And so including rehabs, even rehabs weren't releasing outcomes, and, family members would fork over $50K and not know if this would work or not work. This doesn't happen in other medicine verticals. It just doesn't happen as commonly. So we, a good friend of Lisa's passed away, and a few things happened in my personal life. So we kind of said enough was enough. And we decided to leave our jobs and start Workit Health. So we bootstrapped for a while, and then found some supportive people that were willing to give us some money to get started. And that's how we started.
Awesome. Now, Lisa, could you go ahead and tell me a little bit about Workit Health?
Sure, yeah. So as Robin mentioned, we had a lot of friends who fell through the cracks. So when we started the company, we were hoping to design a program that would be there in your pocket from any little moment of willingness that you might have. So Workit is an online virtual clinic that has everything that you would receive in an intensive outpatient program, but from your pocket. So that means you have access to direct medical care with a nurse and doctor, as well as social work support, to do groups with other people going through the process as you would in a face-to-face clinic. And also you can do one-on-one and more private therapy directly in the platform. And then you have access, the third component of Workit is our courses, which like a core curriculum in cognitive behavioral therapy in these little 5 to 10 minute exercises. And that was a key component that we thought a lot of people that we saw slip through the cracks weren't getting, is that evidence-based ability to think about your triggers from a cognitive behavioral therapy perspective. So we're really excited to make that democratically available.
And now Workit, is that a product of the virtual part from COVID-19, or was this already virtual previously?
So we were already virtual previously. So if we had it our way, we would never have done in person. So Lisa and I grew up in our careers in telehealth and healthcare and telemedicine. And so we've always been big proponents, and 90% to 95% of Workit has always been online. So a really big part of what we thought was important when we started the company was we know these treatments exist. We know treatment works. If you go to a 30-day rehab and do 6 months of aftercare and then 6 months of halfway house, and then you go to AA meetings, etc. But not enough people are getting to that point. It's very hard to stop midstream in life and say, hey, everybody, I'm going to rehab for 30 days. Hey, friends, family, husband, work, everything. I'm an alcoholic, I'm an addict. Surprise, surprise, I'm going to rehab. So what happens, what naturally is the result of that is that a lot of people don't get the care they need, A, and B, a lot of the people that go get the care they need, they're very far gone. They're very high acuity cases. So Lisa and I always from the beginning wanted to open up, crack open addiction treatment for more people. We wanted to do what we call widening the tent. We wanted to kind of open it up and say, what's the most accessible thing in the world? And that's, of course, your smartphone. Everybody seems to have a smartphone, right? And we wanted to make it as simple as ordering a pizza from Grubhub or whatever. We wanted to make it really simple to start and not so public and so exposing. We wanted a private, convenient way to get help right now, not in 2 days, not in 50 days when you finally get booted off a waiting list, right now. So we've always endorsed telehealth, and we are super excited that because of this COVID stuff and because of the easing of some restrictions around telehealth, we're able to practice in a more widespread way.
So now the individuals who go ahead and, sign up or enter this telehealth kind of substance treatment, I haven't been in one myself, but I'm trying to imagine, is it similar? Does it have the community vibe, I guess, that other, meetings would go ahead and provide? Are they able to meet with other minded and, other individuals who are going through the same thing?
Yeah, so great question. Lisa and I, our foundation is in friendship, and our foundation is in one alcoholic talking to another alcoholic. So from everything from hiring our staff to building in group therapy into our app, we've always had a we-centered perspective. So most of the people employed at Workit Health are either in recovery themselves or recovery adjacent. So more, if you're a 12-step person, the Al-Anon side of the house. They've all been touched in some way, somehow by addiction. So from the person you call on the phone to schedule your first couple of appointments to inside of the intervention. So once you start the Workit program, you get to opt in to weekly group meetings. And those are run by social workers. So it's not exactly the free-for-all that some meetings are. They're kind of, we try to cut down on some of the things that aren't so great about 12-step meetings, right? So people who, we just try to make it safe. We try to make it safe and equitable for everybody. But that being said, the community aspect of Workit is a huge component to the program.
And then, Lisa, how do the clients or the personnel who, participate in this, how do they respond, or how have they responded?
Oh, we get amazing testimonials every week. So for many of our patients, they're in treatment deserts. So they're in of their states or their counties that are really far from gold standard care. And so for them, it's I can't believe this exists. Are you guys fake? Are you real? Are you some sort of joke? So it's been really amazing to see that. And especially for people who have really sensitive jobs, we work with first responders, we work with nurses and doctors, we work with teachers, and they've always been so scared in many instances to join the 12-step community because they were afraid they're going to lose their license or they weren't going to be able to practice their profession anymore. And it's really amazing to see those people feel like they can have a safe little cohort from their phone without feeling that they're afraid they're going to run into the parent from a kid in their classroom or who's going to judge them or stigmatize them. So that's been amazing. And then I think for a lot of people, just life, like in COVID, having kids at home and having all these constraints to access care. The most testimonials we get are like, I couldn't do anything if not for you guys, because normally if I was in this bad of shape, I would go to the emergency department, but I can't go. My dad has multiple sclerosis, or I can't go without now all these new risks associated with that weren't even there 6 months ago. So we see there a range of things, but most of the feedback is about the accessibility, and is about that, like, I can do this despite like all this other stuff going on in my life.
And are there certain people who you think fare better in this kind of virtual environment to get the help they need?
Well, yes and no. I think it's pretty democratic. I think it's pretty available for anybody that wants a private way to jump into recovery right now versus later. That being said, we have a lot of young people on the program, and we have a lot of people that have complicated lives, like a lot of people who hold down 2 jobs and have, perhaps situations with their wife or their husband and their kids that are not ideal, and have to tend to that. People that really can't go away because of their circumstances for 30 days. So we tend to see a lot of that. We see a lot of people that are coming right from, or previous to coming to us, have had surgery. So we see a lot of people that are, don't fit neatly into an addict label, but are worried about their use. People that perhaps, got a root canal and got prescribed Vicodin, and then it just became a habit, and then it became a dependency, and don't know what to do. So we see a lot of that kind of person, and all the way to another extreme where Lisa was talking about this, but we have people who are first responders, or people in public profile positions, like mayors and politicians, who simply would not be able to afford the publicity, I guess, the public presence of a rehab, the public statement that I am going to rehab now. So it works for everybody, but those are some very common cases that we see.
And how can people go about, signing up for this?
Yeah, really simple. So one of the things that we remembered from our own journey was just how hard it is to make that first phone call. I think I called someone from high school who I barely knew, but I'd heard she was maybe sober. It was the most awkward 45-minute conversation of my life. And we initially had a phone call built into the onboarding process for our community, but now we saw so many people like digging around for some way to get started without talking to us, that we built completely online sign up. So people who come to our app can just sign up and directly book their first appointment. They don't have to go through all the voices talking in their head saying, oh, you don't want to do this, you don't want to do this yet. The goal is to make it really dead simple so that they can sign up in less than 5 minutes before they talk themselves out of it. Because we know that's such a big part of the people that we loved and lost along the way. It was like, oh, I don't want to wait in this waiting room. Oh, I don't want to wait on this list. So we wanted to just like eliminate that. And that's worked really well. 60% of our patients prefer digital sign up, and we see them signing up that way, especially by age group, like people in their 30s. Oftentimes they don't like to talk on the phone. And so we get higher attention and people attracted to the program that way than if we were just doing a more traditional model of coming face to face and meeting someone in person.
Gotcha. And was Workit hard to start up in the beginning? Was there any speed bumps that you guys faced along the way?
Look at our faces. Yeah. It was so hard. Yeah, I mean, any venture is hard, but this is really hard, right? Like, to go into a full stack medicine provider, we do everything from e-prescribing to drug testing all online. And, we've never done anything illegal, but we've always had to contend with the law. We've had to contend with regulations from a state, from like a city, I'm thinking of the Airstream, Lisa, but from a municipal to a county to a state to a federal level. We've never had to contend with like the UN, but it feels like that's our next go. But so it's really difficult. It's arduous from a compliance and legal perspective to start something like Workit. And then it's just hard emotionally. Lisa and I are both in recovery. We're complicated individuals with complex emotional ranges. And I remember at the beginning of our life as Workit co-founders, we were in this argument about something, or not an argument, but we were in this like heated stress discussion about something. And Lisa looked at me and she's like, I'm so grateful I'm doing this with someone I love. Like, I can't even imagine doing this with a stranger, because there are so many times we've had to rely on each other as co-founders, as friends in recovery, as friends outside of recovery, as two women, you know, it's so, yeah, it's hard. It's hard. Lisa, do you think it's hard?
Oh yeah, I mean, I just have memories in the beginning of some conversations with potential backers who really stigmatized addiction, and you'd be on the call and be like, you know, just insulting yourself and all of your loved ones in recovery throughout your pitch, and you know, just getting off like feeling re-traumatized by those experiences after being like over a decade sober, and being like, why am I reintroducing myself to this like archaic thinking? So that was hard. Or people being like, oh wow, why are you guys telling people you have addictions? You really should.
Ooh, why would we invest in two alcoholics?
Yeah,
we're also, I don't know if you noticed, but we're also women who identify as women. And I mean, we're two people who identify as women. So that's also hard, you know, and it's not the hardest, but it's hard. It was difficult to find the funding and the support and the belief that this could be combated, you know, in this arena, in this way. You're coming up against all sorts of things, right? Like, you're coming up against a for-profit company and like kind of the boogeyman around that. And then you're coming up against, we've always done it in 12 steps. You're coming up against a natural 12-step tendency to not like medication-assisted treatment. So there are a lot of people that are mad at us, you know, like there's a lot of, every day kind of come up against different blocks. And I think it's adherence to our mission. We really believe that the tent should be widened. We really believe that there should be other alternatives out there to what currently exists. So I think it's adherence to our mission, and then our love for one another and our staff that keeps us going.
Now, recovery is, in recovery, every day is a milestone, but what do you all feel or think when, you know, you see people who have entered kind of at the beginning of their journey, and then, you know, they add some time, and, you know, they gain that time. How does that make you feel when you see those kind of success stories right there in the moment?
I think it's been really cool to start to see Workit alums like have the same camaraderie that people have in the rooms, where you have somebody that's been in the program for 6 months, really excited to work with a newcomer whose background reminds them of their own path. That's such an amazing feeling. And to create that magic for people that are in a place where maybe there's one meeting in a 50-mile radius, but they would never find that person, that's really magical, because I feel like the whole recovery community is built on like these few lights of like old timers and people that are just like, they are the bedrock of recovery communities. And it feels really special to be able to open up access to those kind of lights to places where they weren't available, or people can find someone like them, or someone who shares their cultural identity or their gender identity or whatever it is. And if that's not available to them where they're at, that's been the coolest, is seeing that kind of access opened up.
Mm-hmm. Yeah, everything Lisa said. I think it's been an incredible journey. It's an incredible feeling to feel like something that you envisioned, something that you started so humbly, like from your kitchen table, and had no belief for so many years, is like actually out there in the world as a living, breathing thing almost, and helping people lead better lives. Like, we have so many incredible stories come through our testimonials channel on Slack. We use Slack as an org, but it's amazing. It's such a privilege, you know. I sometimes, and I don't know if you feel like this, or Lisa, you feel like this, but sometimes I'm like, geez, like I really didn't know if I was going to make it past age 25. Like, it's such a privilege to be able to do this and to talk to the people we talk to, and to have a staff, and to have these other men and women that are leading. It's incredible. Such an honor.
And then a question for the two of you, to go ahead and look back on your own journey, and then to see where you are now, and then, you know, creating this. looking back, what do you feel about that, about your own success and story?
Lucky, probably. Lucky, but it was also a lot of hard work. You always look back and think, oh, I could have done this or I could have done that. But as a philosophy, I try not to dwell in regret that much. I try as much as I can to lean forward into an optimism, because I think that's my responsibility as somebody in recovery, somebody that also is a leader of Workit Health, a co-leader. I think looking forward is the only way to live. So I would say we're excited about the past. We feel proud of what we've been able to build, but we're even more excited about the future.
And then Lisa, the same question for you.
Yeah, I mean, I think it's so hard when I think about that, like, experience, strength, and hope, like what it was like. I was such a different world. I was such a different person. And I don't think that Lisa would recognize this Lisa at all as familiar. It's even hard to compare. But I think when we started Workit, I was so angry about these beautiful people that had tried so hard to get it and didn't. And I feel like I was carrying the grief of that. And what's most exciting today is I feel like Workit platform has created like a really great thing to honor their memory. So like all of their really powerful things that they gave me in recovery that helped me through a day, or sharing those stories, I feel like memorializes all the amazing things about those people that deserve better. They should have had access to care. They should have had another chance, another try. And I think that's super motivating and super surreal to be able to like not only live through it, but to give that back. I think is really, for me, the most special thing, and what we really hoped for the most when we started was to that, like, honor the lost and the living, and to broaden access to all these other people that didn't make it.
And before we end, do either of you have anything else that you would like to go ahead and say?
No, I mean, thank you for having us on. And sign up for Workit if you have a loved one or you are suffering. www. I'm sure you have the information.
I do.
Workithealth.com.
Well, I guess I have something to say from the perspective of, I know you're coming out of Kern County, and we talked a little bit about treatment deserts, but the Kern River Valley area, there's a lot of treatment deserts. And so you have people traveling daily to opioid programs really far away. And our program offers care for people in these really rural areas so that they don't have to do that. Oftentimes it's really scary to do that. In the past, before telemedicine was legal, people would have to drive with their kids and all kinds of things going on. So making sure that people out there know that rural communities have access to care from home, I think is super important for people to safely get care without having to drive somewhere or completely turn their life upside down, especially in areas like Kern.